Dr. Lynne McRae. I'm the Associate Director of Behavioral Health with the Colorado Coalition for the Homeless. This is my colleague, Nikki. She is a behavioral health provider and a trainer, also with the Coalition. First off, I'd like to thank Dr. Parsons for giving us the opportunity to speak today to all of you, to give you a tiny little snapshot of what we've been working on lately. The Coalition began implementing an integrated model of care in a small satellite clinic called West End. And since then, we've really expanded our model, expanded our clinical services into our current clinic called the Stout Street Clinic. On August 8th, we are moving clinics, which is actually quite a challenge. The Coalition has built a brand new facility, which is just down the street. But what that meant for us is that we have to fully staff that clinic. So when we open, we will be opening with 3 health suites with 3 behavioral health providers in each suite, and eventually we envision having 4 health suites. The purpose of the grant was basically to provide us with funds to create a really extensive training program for our behavioral health providers. And so that's been quite helpful, and Nikki will be going over that. But first of all, we really had to figure out what a behavioral health provider would do in clinic. What does that mean? What kind of specific skill set would be needed for our providers to be successful and work on an interdisciplinary team within an integrated care model? So first off, the second slide that we have here kind of delineates the 2 different types of positions that we have. We essentially split our team into what are called Behavioral Health Providers 1 and 2. The Behavioral Health Provider 1 is more akin to what would be called a traditional psychotherapist. They are people that do more extended care therapy and traditional psychotherapy, such as dialectical behavior therapy, cognitive behavioral therapy. And the Behavioral Health Provider 2s actually focus more on working on the integrated care multidisciplinary team. There are differences between the 2 positions, which I'm just going to go over briefly. For one, the BHP2s provide brief psychosocial and clinical assessments. They show a basic knowledge of key chronic diseases, medicines, and behavioral aspects of specific disease management. They show an understanding of the relationship of medical and psychological systems. They perform brief targeted behavioral health interventions. And they perform medically focused behavioral health group therapy as well. So after we defined the role of what our providers were going to do within their health suites, we created a very extensive training program for our providers. And so with that, I'm going to pass the microphone to Nikki.
Okay, so what we identified was that a lot of folks coming out of traditional training for psychotherapy positions weren't necessarily ready to work in a medical setting. And so I designed a curriculum for the BHP2s that include all of the things that you can see in the wheel, including some of the information Dr. Humphreys provided, including information about who does what in primary care, what are different roles, how do I interact with them as a BHP, how do mental health and substance use presentations look different in primary care than they do when I'm working in a traditional mental health setting, what kind of strategies am I using in a brief intervention role, and how can I support medical disease like self-management of the patient, how can I help with some of the psychosocial and like mood and emotional issues that play into people not being as successful with their disease management, and then sort of how to work the workflow in the medical setting. So we have trained 4 of our BHP2s through this curriculum at this point, and we have 2 more to go. We have, in addition to delivering the curriculum, which is about 20 to 24 hours of kind of classroom setting training, is have them work with current BHP2s, shadowing them in the medical clinic with live in-person training, and then they start doing the work while the trained BHP2 is kind of helping them along to get the skill set that they need. And so We are just about ready for most of those 4 people to go live in the clinic. You can see kind of what I listed out as the benefits to providers and patients, some of which are sort of consistent across all integrated care models. What we learned, a couple things that were really apparent was that we really had to work on like the language differences between the different specialties, and that we had some workflow issues with related to the electronic health record and sort of how we move a patient through a visit when there's now this additional person who may interact with the patient. So we're in the process of working on that. Obviously, that's going to change when we're in a new clinic. So we're kind of still in the process of that, fine-tuning those workflows.